Okay, I will call the Winnebago County Community Mental Health Board meeting to order September 6th, 2023 at 2:00 p.m. We will take roll call, and first off is Dick Keener.
Here.
Bill Gorski, Dr. Gorski, Wendy Larson-Dennis, present. Dr. Copeland, he will be here momentarily. He texted, he's running away. Dr. Giardini.
Here.
Kim Nevers.
Here.
Linda Sanquist. Mohammed Yunus.
Here.
Mary Anabati here. Public comment, and at this time, we're going to ask, I'll mispronounce your last name, but I did have it written down, so I can, it's Mary Trujillo.
Trujillo.
Okay, Trujillo. All right, we would like very much for you to introduce yourself and let the mental health board and also those attending via internet that about your new position. You're welcome to stand if you want, or
Sure.
whatever
Okay.
you're comfortable with.
My name is Mary Trujillo with the City of Rockford, Mental Health Program Manager that was appointed by the board. Really excited to be here and to kind of help bridge gaps between, the two programs and identify, needs and just continue to help the programs grow. I originally was at RPS for the past around 11 years, working with families who are either homeless or in transition, and then also as a social worker. I also worked in private practice for a number of years. So I'm very familiar with, the kind of connections with mental health and homelessness and all the other complex situations that we have going on. So I'm really excited to work with the mental health board, with the fire department, the police department, and everybody involved to kind of help identify needs, bridge those gaps, and help our citizens of Rockford really improve kind of their overall mental health, access to care, and just overall well-being. So so that's my introduction. I don't know if anybody has any questions, but I've only been in this position since my 3rd week, so I've done some ride-alongs with police and fire and kind of dove in head first with, really kind of getting in the field and kind of how the program's functioning. So I'm going to continue to do that, meet with different individuals involved, and look forward to making progress.
So what is your relationship going to be, for example, with the crisis response team?
The crisis response team with the police department and Rosecrans. So I'll be overseeing that program. I'll be managing that program. And then I'll also be managing the MIH program with the fire and UW Health. So there's 2 different programs that I'll be managing in my position. And I'm gonna try to help bridge whatever gaps between those 2 programs to ensure the mission of, the grant is being filled. I really, right now, at this point, really on the ground, I did ride-alongs with police. I did with the CCRT team. I did ride-alongs with the MIH team. I'm gonna do a few more, meeting with people involved. And then also really just analyzing the current data to kind of determine, what are some strengths, what are some weaknesses, what needs to be done moving forward.
And then 911, is that also in your realm?
Yes.
Okay.
Mhm. So I do know that currently the CCRT team works only during the week. So I know Saturday and Sunday are the hours in which 911 would answer those calls, and then they would be referred to those teams after the fact. So I know that was a kind of a something that we're looking to address. I know that the MIH program has some things going where they're looking to have a nurse actually triaging calls, and mental health nurse triaging phone calls at their center. So that's something we're also looking at going forward.
And do you connected with the state's attorney's office?
Not yet.
Okay, because I think that's pretty critical. And the jail.
They are on my list to connect with, yeah.
Because the state's attorney's office is funding a position for a mental health attorney
Oh, okay.
to address some of the issues that are encountered in that interface between the crisis response, the fire department, and the new bail reform act, which takes effect in 10 days, is going to have a huge impact on all of these systems. So getting some coordination there.
Okay, if they're on my list, and so I will definitely expedite that.
Good to meet you.
Thank you.
Yeah, nice to meet you. Good luck.
Thank you. I'm
Yeah,
happy
we
to be
look
here.
forward to hearing, what you analyze in terms of weaknesses, strengths, what, needs are still not able to be met. And the hours are definitely something that, we're hoping that you can seriously take a look at. So,
Yeah. Okay, yep, that's all on my radar, and like I said, I'm really excited to be here, and, I'm definitely up for the challenge, so.
Well, that's great.
I
Good luck.
know there's a lot of moving parts, so.
Yeah, a lot to learn quick. I know.
Now, Barry, will we be hearing from you again in the future? I mean, will you be coming in and just kind of letting us know what's going on?
I do plan on coming back and kind of reporting out different pieces of data or even success stories or things of that nature. I don't know what frequency that might be, like I won't be attending every single meeting, but, I do plan to attend future meetings to kind of report.
That's very helpful.
Yeah. I definitely think that's a big piece, to be able to bridge those two programs of the city and then the mental health board and your expectations of the grant. So I really want to be, a part of that.
Okay, well, thank you.
All right.
In terms of presentations, we have none.
We had a presentation scheduled, but due to kind of a last minute illness, they have asked to postpone until next month.
Okay.
So we will postpone that presentation.
All right. Moving into our monthly activity report. Jason, do you want to highlight anything in particular?
Sure, yeah, I think the month of August was really, well, we had a lot of activity going on. We were strongly focused on getting public engagement on our strategic plan, strategies and objectives. And so we held 3 public open house events, and they were actually really well attended. Even on a very hot 100-degree day, we had like 10 people show up that night to participate and give us comment. We got great feedback, a lot of different perspectives, not huge deviations from where we were, but tweaks here and there of things that people added commentary on. So our process will include essentially now developing a public comment section within the plan that kind of takes into consideration what those comments were, and then what our response to each of those are in terms of, do we feel that that kind of intent was already addressed by one of our existing strategies? Do we feel it's not relevant or not something that's within our scope? Or alternatively, do we feel that there might be something where one of the objectives needs to be tweaked slightly to address one of those pieces of feedback? So that will all be incorporated in the final draft that we will present to the board at the October board meeting for final approval.
That's great. Well, we obviously will have the discussion at that meeting in terms of
Yeah, the timeline's pretty tight, so I don't
Yeah.
think we'll be able to send a draft out well in advance of the meeting, but certainly if there's enough, if there were the need to push it back a month because there's additional feedback from the board, we can do that. October would be a nice month to get it approved, but if it doesn't go until November, that's okay. So I think maybe that's getting to the intent of your question,
It
which
is.
is, do you have enough time to really dig into it?
right,
We can make time to dig into it if it needs more digging into.
right, because I think we might need to.
I wonder if we could get, like, some of the raw comments not incorporated into the report, just so that we could read them and then see how they're incorporated into the report.
Sure.
Just something, yeah, it's just useful to hear what people had to say. I don't know if it's not too disruptive.
Was there any feedback from consumers?
Yes.
How was the feedback from consumers?
In my mind, I can't filter the like specific comments that were connected to consumers and those that weren't. So I'd have to look back at our notes. The way that we took public comment, we didn't have people specifically, we did it in a group setting where all of those comments were kind of aggregated by session. But we did have some of the people that were in some of those feedback sessions identify as consumer. I just want to maybe point out for everyone watching and for the board, the public comment was meant to be feedback on the strategies that we had developed and objectives we developed. It wasn't in and of itself the community perspective of the research portion of the plan, which had already been done, and that included consumer perspective extensively, if that makes sense. So it was a process where we did community engagement, developed strategies and objectives, gave the community an opportunity before those are finalized to say, are these the strategies and objectives that we should move forward with?
I was more concerned about the consumers. Are they happy with the service they are receiving through our grant agencies? Are they happy?
So when we did our public participation survey, we did not specifically ask that question. It wasn't a consumer satisfaction survey as much as it was what are the services that you're having trouble accessing? What are the services that you're finding easy to access? So it's more of that system level view than kind of like, are you happy with the service you're getting? I think so. Is that?
Okay.
So that's where we're at. Not to say we couldn't do more in the future, but that's what we've done.
And also, just, in terms of the consumer satisfaction, each funded agency, that's part of the funding contracts that they have to have a way to have the consumer feedback. So that we require that.
And they report on it monthly, so we receive monthly reports from all organizations on outcomes they track regarding consumer satisfaction.
So, like overall, they're happy with the
No,
service
quarterly,
they are
it is
getting.
quarterly, sorry.
Well, it's agency of service by service. So overall, that, I don't have that information right now, but maybe Nicole.
What was your question, Mohammed?
Research agencies, they do have
Yeah,
feedback from consumers,
Yeah.
consumer satisfaction. But I was wondering if the overall comments are negative, positive.
I will send everyone a summary of the comments that we received. We already have developed a draft of that, so I'll send that out to the board and you can see specifically what the comments were.
So really,
that's helpful.
And then if you have direct feedback from the board members, if you want to give in terms of how those are incorporated, I'm happy to take your feedback on that as well.
Yeah, their feedback is key.
Right.
Because if they're not happy with the services they are getting, then they are not doing our job.
So is that?
Yeah, that was the main, like I said, that's been we have a lot going on all the time. That was kind of the main push this last month, was really getting that community engagement and feedback before we finalize things.
And I just want to comment that I think it's really impressive that we have that much interest from the public to come at night and give input to a strategic plan. I don't think I've ever gone to a meeting to do that. And I'm just impressed that we have enough interested people to take time out of their evening and come, they care that much. I like to know that, and I appreciate it so much. It's helpful. Okay, moving on, we have one action item, and that is that I need a motion to approve minutes from the July meeting. Okay, Wendy Larson, Bennett, and Kim, seconded. So we can do roll call, or we don't have to do roll call, we can just do it general. All those in favor, please say aye. Opposed, same sign. Okay, thank you. Now moving quickly into our discussion items. First one is the changes in the Community Mental Health Act. And Jason, you just want to highlight what that?
Yeah, I'll highlight. So there was a bill that was passed through the House and Senate, House Bill 475, and the State Association, ACMI, really monitored this closely and actually worked with the Metropolitan Township Association and the township, I think it's the Township Organization of Illinois. So a few other state associations to make sure this was really a collaborative effort that represented the interests not only of the mental health boards, but also the governing bodies who are responsible for collecting the mental health taxes in various municipalities and counties. And ultimately, what was reached was some changes that were really put into place to help clarify some places where there's been lack of clarity and to establish a good balance between what some of the newer boards are struggling to deal with in their areas, where many of them are having a lot of contentious relationships as they're being formed. So I'll just give you a quick highlight of what ended up being in this, and this did get signed by the governor sometime within the last month and will be effective January 1st. So first is the budget authority, and this act makes it more explicitly clear that the community mental health boards have the responsibility to set and maintain and implement their budget. As well as if they chose to, they could establish their own fiscal year that could be different from the governing body. Not suggesting there'd be any reason to do that, but they could if they chose to. On the issue of board appointments, one thing that was added, it was made more clear that only one member of the governing authority can be appointed to the mental health board. So Tim is that member of the governing body from the county board that sits on the mental health board, and it can only be one. So that was clarified. That's always been practice for mental health boards, but I don't know if it was explicitly clear in the act. And secondly, this is kind of a weird one. Nobody's quite sure where it came from, but it made it into the act, which was when there's a new appointment to a board, to the mental health board, the board must meet within 30 days of that new appointment and hold an election of officers. So while we've always done that election of officers June of each year, going into the start of that state calendar year starting in July, let's say there were a new board appointment for a vacant seat in January. The board would then need to meet, and you'd have to have a election of officers in January, and then you'd have another one in June. So
You have to meet, or would it just be a suggested thing to do?
no, you have to. It made it very clear that you have to meet. So just something to know that, I mean, there are no open seats as it stands, but if there were new appointments at some point, we will have to be aware of that. And then lastly was just a clarifying point. And again, like I said, some of these were already known facts, but just were put in there for clarification for many of new boards who are asking questions. Are we under FOIA? Are we under Open Meetings Act? Yes, you are. So it was clarified in the act now that all mental health boards, as public bodies, which they always have been, are under the requirements of Freedom of Information Act and Open Meetings Act.
Any discussion about that? I mean, we're not voting on it. It's a discussion item, so.
Interesting. I would just say it's kind of, Jim, good thing you got the one of governing body.
Andrew, Tim, you're our FOIA person, right?
Yeah.
Okay, that's what I thought.
Okay. Hearing no further discussion, I will move on to our second item, which is Behavioral Health Advisory Committee update. And this is the committee that the mayor put together, and Jason attends the meetings. And basically, I'll let you.
Sure, I think this was a moment, the group has met, I believe, 3 or 4 times. They did take the opportunity, and I appreciate the respect, to let us present to them what we had done on our strategic plan. So I presented a draft of our strategic plan to the group and all the research we had done in process of that. They were very complimentary of our work and made it clear that they did not want to duplicate the efforts that we had done. But there has been some conversation about, is there a need for a deeper dive on some of the more healthcare utilization data, and maybe more specifically around inpatient use and inpatient beds. And in that conversation, one of the options, I guess, that has been presented by some in the group is about hiring a consultant. And there's a price tag associated with that based on what would be a comparable type report, which I've sent you some attachments that you could review of what those types of deeper dive reports look like. So one of the things the committee, I mean, just very transparently put out there was, if they were to go down that road, they would really be looking for the mental health board's financial support on something like that. That's not something that any of the entities there have a budget for. So I think it would be a nice time to give some feedback before maybe they go too far down that road as to whether or not the mental health board feels that is within scope or not of what we're trying to accomplish.
Can I jump in? I've reviewed some of the documents all the documents you sent us. And the first question that comes up in my mind is, these are dated. The materials that Milwaukee provided are old. They're out of date. I'd like to know what level of implementation there's been based on this study. And my experience here in Winnebago County is, you could fill this room with consultant studies that have been funded by various aspects of government over the years, and then are left to molder in a closet somewhere. So my thought is, before we start, first of all, funding studies based on another municipality's experience, I'd like to know how well the hospital systems, the mental health systems, the addiction systems in Milwaukee have utilized the material that was generated, looks like almost a decade ago. And, you know, was it a worthwhile expenditure? Did it change anything? You know, one of the documents you provided us didn't seem to change much. I saw, you know, incremental changes, but, and I have a concern because there was something about the Wisconsin community care system. There was apparently a funding commitment of $1.8 million. Well, we know that that's just, you know, a pittance when it comes to providing services. It's almost laughable in a city the size of Milwaukee. So my understanding is there are people on the city board that are in charge of our mental health systems. I want to know what kind of commitment they're willing to make to following through with any recommendations that come out of any studies. But more than that, we have already expended resources doing research. There are other community groups that have already expended resources doing research. For that matter, Javon Bay shut down the entire mental health program in their hospital, alleging there wasn't a need. I'd like to see the statistics and the materials they used to base that decision on, and ask the state of Illinois to allow them to no longer offer services. So I think we have resources here in the community that can already answer the question about utilization. I mean, the hospitals just have to turn over their data. I don't know that another study is gonna help much.
Well, from my perspective, I think what we really have to take into account is, you know, that all the data that we had gathered from the beginning of time and all the environmental scan and whatever. I just want to know in my mind that we have a level playing field with the committee that is asking for the study to be done, because I do believe, you know, being in mental health for 41 years, that I have seen many studies over the years. And I think that we have a framework, and the Mental Health Board has funded a framework. We have the CRT team, we have the mobile integration, we have the triage center, crisis residential, 16 beds that for 14 days for people in our community. And it's easily justifiable to extend the time somebody needs stabilization and the beds can be continued. So I just want to make sure that people asking for this study have all the current information regarding all the funding that we have done. And I really feel like they need to see the facility, they need to see the beds, they need to see the operation. Maybe we need to enhance, I don't know. But I don't want to throw out the baby with the bathwater. I don't want to just jump to a new study without knowing that they are well informed of all the services that we currently have ongoing and are funded and are really opening access to people when they need it. So that's my perspective. I'm not against a study, if that's what is called for, but I am against the idea that we start at different starting points. And I don't know that the committee, the behavioral health committee that has recently been formed, really understand what we have going on.
No, go ahead.
So, first of all, I agree with what has already been said, and just to add, because the question seems to be from the committee's perspective, are we willing, or is this, or would funding a study be within the scope of what we feel is our mission and so on and so forth? So, back to the first two comments, I agree, particularly as it relates to all the studies that have been done, and more importantly, the work that has already been done in this specific area. I think that two things, to Mary Ann's point, that we need to figure out or ascertain if they really know what's going on right now. But then secondly, even if they do, is there a way that they can get the information that they believe they need without doing a study? Hence, what Wendy was talking about in terms of, well, talk to the healthcare people, or, I mean, the data is somewhere, so why do we need to pay a consultant in order to get data that should, given the framework that we've put together and given what the city is trying to do, that we should be able to access anything. So, like Mary Ann, I'm not against studies, except to the extent that I want to know that a study is actually going to be used. But then on top of that, I'm saying, is there not a way that we can get the information that is needed without paying somebody on the outside to do a study? And in point of fact, we know who the individuals, we know who the players are. Hey, give them information, or let's work together, since we see that we're all pulling in the same direction.
That is
And I was very, very much in agreement with what you say here. Almost going to echo your comments. Wendy, you said it right. They did a study, so it wasn't needed. Well, let's see your study. Mary Ann, you're right. We've done enough studies, but if those are studies and that study, if we find something that wasn't covered, then fine.
Oh,
We've got
I wanna
enough
know,
people in
yeah.
this town that are smart to figure out, we're gonna go hire consultants. There's enough people around here that can figure this out without having to do that. And I agree, Ed. I mean, you're absolutely right. What you said was, I will just echo. Show us a study that said that we didn't need it, and we have the studies to prove otherwise, and let's put it together and find out what we have to get. And I bet we don't need another study to figure it out. We just don't, in my opinion. I could be as wrong as right on a parade.
Mr. Hill, I've got to say, now you're in a unique position, particularly with the Rockford Emergency Services. they know how many people they're providing services to, right, over the last couple of years of funding. They know who's being delivered to UW emergency rooms. UW can tell us how many people are being, put in 72-hour holds versus how many people end up actually being involuntarily committed or, agreeing. We know how many people end up in the jail who have diagnoses, because we have all these programs going. At least at the inception, let's try and analyze the data that we've already got here. And look, we have Rockford University, we have Northern Illinois University, who are already based here in Winnebago County.
Well, I think the School of Medicine.
The medical school. Yeah, these are all research institutions that my guess is a little outreach and connection might generate some very interesting information without going to, you know what an expert is. Someone who agrees case who lives 50 miles away, let's stay in our own little acre and see what we can figure out ourselves. Because I think a lot of the work has already been done and is already there.
But I believe that we need to have current need assessment. We are pouring in $18 million, not knowing what the needs are. And there are a lot of studies, but they are not specific about our area.
Exactly.
And we need to know that by some professionals, not based on anecdotes, our experience. Our experience is limited to a certain situation, but we want overall picture. Where we are pouring in $18 million, not knowing what the needs are.
Well, but we do know what the needs are
No,
based on
this is
our
what we
assessment.
are saying.
Oh, okay.
And the professionals, they do the job all the time. And I was wondering if someone who knows about the Milwaukee project can give us some kind of presentation so we can ask questions and answer that. What?
So I'm on the side that it's always good to have a group of people on the outside looking to help us. We may feel like we already know everything, but they may be able to catch some things that we don't know. And doing the study is, the Milwaukee study was like $200-some thousand. We're far smaller than Milwaukee, so I can't imagine that study costing that much right now for the city of Rockford. And I think it'd be good to get an evaluation of how much the study would truly cost for us versus the one that was in the quote, because we're not that big. And sure, we know everything that we think we need to know, but someone on the outside looking in might have a different perspective and may help us to further and be deeper and into what we already have. So I think a study would be good and they are useful. And if it's not useful, then we know we're doing a good job. I agree with that philosophically, except that, and I agree with has already been said, except to the extent that if I'm understanding correctly, what the committee wants is certain data points and some specific data points.
That's right.
Those data points, they're not looking for something complicated. They're looking to bore down into some specific data points, if I understood correctly, in terms of like inpatient, this and that.
I think looking at healthcare utilization would be one of the, probably one of the focus areas from where the conversations, but I don't think it's like 100% everyone's in consensus about what it should.
What they actually want.
Right.
See, then that's another problem. From my perspective, as it relates to the study, what do you actually want?
That's been my question.
And that's all I'm saying. If what you want is, utilization, this, that, and other, that's a data point. If it's a data point that we're after, then we can get that information. Now, if it's something about process,
That's different.
that's a whole different thing. Yeah, maybe we do need somebody on the outside to come in and say, okay, you're a little bit too close to the problem, let's take a look at it this way or whatever. But if it's something as it relates to just raw numbers that we're after, then from my perspective, I think that we can get raw numbers and we have enough firepower between Rockford University and the University of Illinois College of Medicine to crunch numbers. Now, if they're after, so I guess the first question is, what do they really want? Because if they're after something that's process related, then I agree with what Tim was saying. But if it's just a data point, then we can get that information.
In my view, our model is still working. The CSP, under the 11 services, under treatment, it's a cornucopia. It goes from the least restrictive set of services to the most restrictive set of services, which are inpatient beds. What we have funded is the wide part of the cornucopia. We're funding the least restrictive services, trying to do that in a major way to keep people from going into the most restrictive, the most expensive part of the system. Now, has our data at this point given us the tools to look at inpatient services? We haven't gone there. We haven't in fact dove into that area. And so if that's their question, you know, they're right. We need to get the data to tell us, like, okay, if the literature says, for example, that 50 beds per 100,000 is the model across the nation, that would give us 141 beds in Winnebago County. We don't have near that in terms of inpatient psychiatric beds. But when you start talking about beds, you're talking about supportive housing, you're talking about crisis beds, you're talking about a whole plethora of different levels of acuity that you're wanting to plan for. That part we have not done, okay? And so, but at the same time, you know, do we, like, I agree with you, that we have the capacity within our world, academia and what we have, that we could, if that's the issue.
That's the issue.
If that's the issue, yes, we can go toward that and take a look at it. But it's kind of like, so again, have we accomplished everything that we want to in the wide part of the cornucopia? No, because one of our biggest problems is workforce, is just having the people to do it. You know, for example, the police and fire department, you know, we want that at 24/7. They're not there. Okay, we want crisis beds 24/7. We need that in terms of, and we have to make sure that the people are routed in. So those are things that we're still tweaking. We're still talking to people. We're still developing. It's, you know, so in my mind, it's not because we don't know what to do. It's a matter of having the people in order to get it done. And so that's, you know, that's the difference. So again, I'm not for bringing in an outside mind. I don't think we need that because we have a history within this community of knowing how to do good programming. We didn't quit because we wanted to, we quit because funding stream went away. What we're now being graced with the opportunity to use this money to bring back the good things that we had shown that worked in the 80s and 90s. And so that's the part that we're into now.
And I do think too that the study has to, if there is a study, it has to incorporate what is already in place. Because in order to know if we need enhancements, then in fact, that has to be set from the crisis residential. Really, if through the courts, and I'm talking the Supreme Court as well as the appellate courts in Illinois, we're seen as a gold standard. And I did a lot of comparison traveling during the time that we were looking at crisis residential beds. And very few places in the country had anything like that. And I don't think we're done with enhancements for that particular model. But remember, people go into vets, but they don't live in vets. If you don't have the supportive needs and resources in the community, they're gonna be back in the vets. And that's the life that we have tried very diligently to prevent for people with serious mental illness. That revolving institutional door, it really worsens every prognosis, and it's a proven, all the research points to that, so.
And the other piece of that, and this goes back to reaching out to the state's attorney's office, because the state's attorney's office is the one that's charged both in the criminal and civil side of providing resources. When someone is Form 5'd in the emergency room, you know, okay, so they're admitted for 72 hours, now what? If that initial assessment says, oh, we can't hold them any longer, and they don't agree to stay, are we just throwing them out on the street? That's what happens. Are they just bouncing over to the jail? That's what happens. That's the truth of what happens, because we don't have exactly what Dick and Mary Ann are talking about in any reasonably developed level here in the community, so that we can say, oh, you're in a crisis. How about not going out into the January weather now that the 72-hour hold is over? How about we have this housing resource for you that has supportive care available for you? How about we connect you to these resources? You know, oh, you have a family, okay, and they're living in the car, okay, let's connect you to the next better level of resources. And a lot of that has to do, I think, with an assessment of the legal system in Illinois and how we are able to manage people with serious mental health and addiction problems. Right now, and I'm not saying this is bad, but it is reality, we opt for freedom for most people with serious problems.
But that's mental health code too.
That's what I'm saying. The mental health code says we're gonna opt for giving people the ability to make their own decisions, even though the community might think that that's not a good set of decisions, right? We believe in freedom. Well, maybe our community needs to look at that from different perspectives.
Yeah.
And, you know, maybe something this committee could become is a lobbying group that is talking about maybe the mental health code needs to be changed. Maybe we need to change things, you know, when it comes to medication for people who are refusing medication. I don't know the answer, but there are a lot of areas that affect why the inpatient beds are revolving.
But the important thing is, as a mental health board overseeing the current funding that we receive, we can't lose sight on our plan and our, you know, we've just developed this new or enhanced our strategic plan. I really think that we want to at least have a consensus, a comfortable consensus that we can let the committee know how open we are to input. And, you know, if in fact we can share just the general knowledge about our programs and know for a fact that they, you know, literally can explain what we have so far and still want to go forward with the study. Or, and I'm open to that whole idea as well. So I think we really do want to come away from this discussion with just a general direction that we would like to offer to the committee from our perspective as to what the mental health board would like to see. You know, what we'd like the next steps to be and how we can be helpful in the direction that they go.
I think that, to that question, I think part of it, in addition to what you've already said, part of the next steps needs, from my perspective, to be clarity from them in terms of what they actually are trying to get from a study.
Right.
Because for me, that's the issue, because if it's some kind of process, sort of organizational, sort of systems piece, then I agree, maybe a study might be useful, might be helpful. If it's something that is related to data points or specific information that we know is already within the system or within the framework, then that's a different conversation.
I think that we are too close to the problem. Could be biased. Because we don't see things as they are. We see things as we are. And keep that in mind. I mean, it's very basic. And an independent study, this is what we need, I mean, to know exactly what is going on, what the need assessments are. And of course, when they do the study, they will review these studies done before, whether they are applicable or not, because most of the studies was done 10, 15 years ago.
Right, exactly.
And things have changed a lot since then.
Mhm.
And keep in mind, we are pouring in big amount of money.
Obviously,
We need to know the money is being spent the best way possible.
I think we all want that, for sure.
Yeah.
So any other recommendations at this point in time, or?
Do you feel like you have a direction at this point? or-
Well, it's,
Jason.
Jason,
Yeah,
do you
Jason.
have any input? I mean, you were on the meetings and.
Come on, Jason.
He just wants to know, he's supposed to report back to the committee.
This is a very thoughtful conversation. I'd be happy to communicate these perspectives back to the committee. And I think that maybe the clarity on what is really trying to be addressed, and maybe at some point, if it were appropriate, to have members of the committee come and directly present to the board so that there is an opportunity to paint that vision. Maybe I'm not articulating it, to the board, what those that are more knowledgeable about it are thinking, and let there be some feedback. It sounds like that might be one part of the next step that would maybe provide a little more clarity.
And I'd also really emphasize the points that Mary Ann talked about sort of making sure they understand what the mental health sales tax has accomplished already here in the county and what the actual resources are.
Well, the beauty of our meetings are that they're recorded on YouTube, so
Right.
I'll just send the link.
But they're not seeing or feeling them, it's a big difference, So I agree with your summation that, we would like a little more clarity as to what they want to do with the study. And, the proposal for the study, if they want the mental health board to fund it, would have to come to us anyhow. And we'd have to, be very clear as to what's involved. And also, I'm just really counting on our current programs being a part of that study. Because I don't think you can just leave that out of the picture. Okay, any other points of view at this point? All right, very good. So we have one more discussion item, and that is, I've lost my agenda. Where did I do it?
Special projects.
Okay, the special project funding. How, are you gonna
Yeah.
explain to us?
Yeah, so let me just get back to context quickly. We've talked about this a little bit at the June meeting when we were approving a budget. And it was kind of that big picture view of, okay, we're at a place now where what we are funding as part of our core programming has finally reached a point where if everybody's utilizing 90% of their awarded funding, we're keeping pace with the revenue that's coming in. But we still have that fund balance that built up when we weren't spending as much as coming in. So, you know, we put in a line item for special project funding. Now the question is, what do we focus that in on? What I think we don't necessarily want to do is tie up more funding in programs that are going to have long-term need, because you put yourself in a position where then you're either going to have to pull the money away from the program, or at some point your revenue, right, you spend down the balance and then you don't have the money you need to continue all these programs, and you're pulling money from funding. So we started to look at some research. Some of it's been in past board conversations, some of it's research how other funders do things that address system capacity with injection of capital that might be short-term, that improves the system, but isn't tied up in long-term funding. And so we're looking at what a lot of people call accelerator funding. So that's a term that we didn't just make up, but that's how some funders are utilizing their funding, particularly when they're trying to do systems work, system capacity improvements. I think by intention or by accident, we've already done some accelerator funding. Both of Stepping Stones grants are perfect examples of accelerator projects. We gave them money to build a counseling center in a part of town that was underserved. They built it, and within 2 years, they're completely financially sustainable and do not need long-term funding. They've already communicated to me they don't anticipate for that program needing to apply for another year of grants. Same thing with their supported housing. One time, they build the supported housing, they already done one rehab, they're now building a new facility. In both of those models, they already have the financial model built. They know the exact number of rooms they need in that facility for it to be financially sustainable. They just need the capital. So those are really tangible, good examples where it was physical capital improvements. I think we also have to think about what accelerator projects look like when we're talking about human capital, because we know that workforce is one of our biggest issues. And so there needs to be some investment at some point into human capital, because our entire system is failing if we don't have the human capital. So it's another type of accelerator project. What can you put in over a 1, 2, or 3 year period that better shores up that pipeline from high school to whatever level of college is needed to get more workforce? And then we also, when we're thinking about capital, we always hear that third type of capital. You have physical capital, human capital, and social capital. And we know that there, throughout our time, have been an understanding that certain populations within our community are underserved, and we haven't seen the response from smaller nonprofits in all cases addressing some of that. So we also wanted to think about what would it look like to maybe have some accelerator funding available, not for long-term programming, but for short-term action projects to say, how do we not just create a program, but how do we partner with the traditional providers of mental health services to better create a culture of cultural competence, cultural humility, whatever it may be, within those systems that has that long-term change effect. So again, it's not long-term funding committed to it, but a short-term injection of capital, the opportunity for that, that's going to maybe provide training or change within a provider that's going to have long-term better opportunity to serve those underserved populations within our community indefinitely, right? In perpetuity. So that's our initial idea, okay? And so we've outlined that in a very brief kind of what could be the foundation of a proposal process. We think for this type of funding, maybe we do something where it's not one time a year, but it's a quarterly rolling basis. And the board could either set a cap for the year and it's until we reach that cap, or we can just continue to assess it on a case-by-case quarterly basis, knowing that when we get to the bottom of the fund, then that's it, right? Like, but we're not even close to that right now. We're definitely north of 30 on the fund balance, so I think we're pretty far away from having to make difficult decisions based on fund availability. It's just more what's in scope and what's most strategic at this point in time. So putting that out there, and then I think the third type of funding we need to look at is what are, as we identify gaps that we haven't received in responsive proposals, what do we do as specific requests for proposals around a specific project where we say, just for example, we've done 3 years of grants. Nobody has given us a proposal for an eating disorders intensive outpatient or any type of eating disorders program. We know we don't have that type of programming. At some point, do we do like a request for quote, request for proposal around a specific project, and we say, we need a provider for just this. So then you'd have 3 types of funding, and you'd have, this would kind of be the thing that's more short-term, 1, 2, or 3 year projects, improve system capacity, doesn't need long-term commitment. Just wanted to get some feedback on that before we maybe formalize a proposal and put it to the board for approval.
Yeah, go on. Keep that in mind. That's terrific.
And
I mean, we already know, we've got the School of Social Work that we talked about, that we can help. We have that, in my terms, the proposal on Wet House that I talked about, the need for a place to get, people who are addicted off the streets. So for housing, so yeah, I mean, that's terrific.
My question is, would it be on the same rotation as our proposal requests come in? Or can it be anytime during the year that this could happen?
I think we'd want to have it where the decision-making part is quarterly, because we can't, it's gonna tie up board meetings pretty significantly if it's a monthly, just anytime we get a proposal, we bring it forward.
Okay,
We'd have to look at process a little bit more. One of the things that I've heard from board members is it'd be nice sometimes to maybe come in and talk about some of the things we're trying to fund. When we're looking at 44 programs, it's hard to do that, right? And we know on that, the funding we've had so far with the grants program, we've had that cap each year, so we've had to be really strategic, take the review process and kind of put together a package of what we want to fund. With these, we might be able to have a quarterly board meeting that's dedicated to just going through the 5 or 10 that we've received and have some conversation about it and do up-down votes on it, knowing that there's not a certain number that we're necessarily capped at. So I could take feedback on process if you have preferences on that. But I think we would try to offset it where the burden on the board members isn't extensive to be reviewing all of the renewal programs while reviewing these
Right.
all at the same
that's what I
time.
was asking.
The issue I guess I have is, we know the gaps, we identified one of them. I would like to see us maybe, as a board, target particular gap areas. Like I have an interest in young kids, we don't have much meaningful support for families dealing with young children. Identify organizations that might be able to step into that void with our financial support and go to them. Let's call, it's not called Chazzy anymore, what's it called? Bright Points or Bright Points? Go to them, say, we know you have an expertise in children. We want you to ask for money from us to do this in a time-limited way that then could be self-sustaining. And see if they respond. Go to the U of I and say, we know you want to do a social work program and there's a problem with getting internships. write us a proposal so that we can financially support internships to bring more social work candidates into our mental health system here in Winnebago County. What, thinking that way, in addition to just putting it out there.
Yeah, so these would be more focused on the system capacity improvements that aren't direct service programs, but
Okay.
I think the third type of funding that we would do is where we have direct service gaps that we know are there that nobody's given us a proposal for. We do a direct request for proposals, but I think for those, we have to have some period of time that allows for any organization that's interested to respond to it. And then we have to do some type of scoring or review process from my understanding of just the procurement requirements that are associated. So I think this has the capability to be a little bit quicker and more emergent than when you identify a specific gap. Very specifically, we want somebody to do this exact type of program, then I think we have to get into a procurement process that allows multiple entities to respond and scores them according to some criteria.
Even according to our own values as ways to equity and all those types of things.
Yeah. So I think it's three things, basically. I mean, this is a new idea, but the three ideas are evaluating the renewal of our current 44 programs, an accelerated process that gets at system capacity and can be a little quicker moving, and then targeting those direct service program gaps with specific requests for proposals and said, we need somebody to do this exact program.
So I think, as it relates to this, I think this is great. I think we should move forward with it.
I do too.
And I particularly appreciate how you divided up the human, social, and physical capital aspects of it. It's brilliant.
Yeah, and credit to Nicole for putting this together. This is her work and research.
Excellent, very excellent. Okay, moving on to other matters, we have nothing to discuss.
I would like
as far as
to
I know.
We're adjourned.
Okay, moving on, okay.
It's just a
I need-
matter of time.
I need a second. Tim, thank you. All those in favor, please say aye.
Aye.